Awesome. Well, welcome everyone. Thank you all for joining the Colorado Fiscal Institute today for the release of the Colorado Baby Bonds Feasibility Study. My name is Esther Turcios, and I am the Deputy Director of the Colorado Fiscal Institute. I am joined today by my colleague and co-presenter Blair Bacon. And we are also joined today by Dr. Tran Doan, who's Assistant Professor of Health Systems Management and Policy at the Colorado School of Public Health and the Principal Investigator of our study. We are also joined by Alyssa Hernandez, PhD candidate of clinical psychology at the University of Pennsylvania and the qualitative lead researcher on the study. And finally, Ainsley Buck, clinical psychology doctoral researcher, who is also a qualitative researcher on our study. Welcome all. We are excited to welcome such a diverse audience today of partners and colleagues, many new faces from Colorado and actually across the nation, which is really exciting for us. Here's just our recent presentation roadmap for today. We welcome everyone to introduce themselves in the chat, tell us who you are, who you're representing, and a few words about why you decided to join our release event today. We will have time at the end of the webinar for a Q&A and some discussion with our research team who are going to be talking about the findings. And we are recording this presentation. We will share the recording, the final report, and some fact sheets with registrants after the presentation as well. So you will have access to all of this. Awesome. Well, since we have a few new faces joining us, I wanted to take a moment to introduce the Colorado Fiscal Institute. CFI is a statewide policy advocacy nonprofit. Our mission is to advance people-centered tax budget and economic policies, and we do that through advocacy at different levels, high-quality research, strategic communications, and statewide education. And since 2004, we've been working with our grassroots partners at Soda Soul Sisters, a deep partner who unfortunately could not join us today, to better understand how we can work with community partners to advance wealth building policies in Colorado. That work over the past few years led us to August of 2025, where we commissioned a feasibility study to assess how a public baby bonds program could be implemented in Colorado. And we went through a thorough RFP process and selected the Systems for Equity and Economic Dignity team, or SEED Colorado, based at the Colorado School of Public Health at the Anschutz Medical Campus. And we tasked them with addressing 4 objectives: assessing the landscape of wealth inequality in Colorado, identifying sustainable revenue sources, evaluating the fiscal feasibility and policy impact, and providing baby bonds policy recommendations. And we are really excited. It's been a labor of love. The study has finally been completed. And so we are joined by the Seed Colorado team today to walk through the findings. But before we get to that, we are honored, excited to welcome our special guest, Dr. Darrick Hamilton, to ground us in the work of baby bonds and the movement. Dr. Darrick Hamilton is a university professor, Henry Cohen Professor of Economics and Urban Policy, and the founding director of the Institute on Race, Power, and Political Economy at the New School. And along with William Darity, is one of the architects of baby bonds, one of the leading voices on this policy. So, Dr. Hamilton, thank you so much for being with us today. I'm going to stop sharing my screen so we can see you. Thanks for making time for us today. We know you have a really busy schedule. I wanted to, before we jump into baby bonds, give you an opportunity to talk briefly about the purpose of an economy and why investing in people should be a North Star.
Love it. Well, first, gratitude. Thank you for this work and this movement. And this Zoom is a mosaic. When we didn't have the split screen, looking at all the beautiful faces. I'm here at Policy Link, has a conference, and that's in part why you see the American flag at a hotel and at the National Harbor. But the setting that I'm at is fitting with this and the word choice that you used, which was movement. So here, Policy Link, the framing is about we are the founders. So it is recognition that, broadly speaking, we can define the economy we want and invest in it. Policy Link has a big framing on politics, kind of like America has had multiple foundings, and in this moment, many of us might see a lot of vulnerability. We look at our affordability crises. We look at some of the stuff that's happening with regards to immigration, international. Uh, we right now, if you open a newspaper, there appears to be a trade war with Canada. So all these things are happening, and that is in part the context in which baby bonds emerge. It isn't simply an isolated silver bullet policy. It is an answer to a fundamental question: what is the purpose of an economy? If you take Econ 101, you'll learn about the what, the how, and to whom. But enough time is not devoted to the normative aspect that we get to choose and define the economy we want. And if I were to answer that question, and I suspect many others in this Zoom might answer it similarly, a purpose of an economy should be human flourishing. It should be to promote tranquility. It should be to promote innovation. It should be to center people in the environments in which we live as the point, the purpose, and mechanism to achieve that economy. So, with that understanding, uh, and again, a lot of these ideas aren't so novel. Coming out of World War II, there was the UN Declaration of Human Rights, which had the conception of how do we fulfill human flourishing. And they talked about political rights, civil rights, social rights, cultural rights. Unfortunately, economic rights, which was included in the UN Declaration of Human Rights, over time has been essentially marginalized and presented as an aspect of tyrannical government. So now I'm being esoteric. I'm going to get clear and coherent and really hone in on baby bonds is fundamentally the idea that assets are critical for people to have economic agency in their lives. Income is important, but more than income, the capabilities of having a nest egg, the capabilities to be able to absorb variability or vulnerability in an economic downturn, having assets should not be the exclusive domain of the wealthy. So we operationalize it in the form of trust accounts for everyone as a birthright. And again, not as a handout, but as something to allow an individual to get into a home and a benefit from the passive appreciation of that home to be able to finance a debt-free education or some capital to start a business. And I'm talking a lot for a simple question that you asked, but I'm going to put a button on this answer by quickly describing the evolution of the idea. It stemmed from the great work that moved us from thinking only about income into thinking about assets as a field. So many of us might be doing child savings account and learned the benefits of can poor people, the seminal book that was written by Michael Sheridan, Can Poor People Save? The answer is absolutely yes. Well, baby bonds is an evolution of that. Baby bonds is an evolution of, at the time, the political marginalization of the conception of reparations. Reparations is a complement to baby bonds, but baby bonds evolved from ideas and recognizes that at the end of the day, people need investments in account at birth. And the last part is, as we see Trump accounts right now, the idea still faces some hurdles and vulnerabilities.
Thank you so much for that needed context and grounding. I'm curious with that, especially because, 530A, or commonly known as Trump accounts, have been in the news, have gotten so much attention lately. Why do baby bonds matter now more than ever?
I mean, that is the right question. I'm gonna make my answers sharper and crisp because I know you got a long webinar that's going to take place today. Uh, 529s might seem like a great idea, but the problem is very few people utilize it, and those that utilize them are often higher income because Americans don't often have money to save in the first place. It's not a question of ignorance. It's not a question of parents not loving their children. It is resources to save in the first place. So 530As are essentially the same structure as 529s, only they open up beyond education the usage for the accounts. So the problem with 530As versus baby bonds, the real crisp idea is that the reliance to build the accounts is on the capacities of families to utilize the tax code in a preferred way. And right now, America diverts too much of our resources to subsidizing the assets of people that already have assets in the first place. Baby bonds is intended to do the reverse, democratize access to assets.
I love that. What a powerful note. Democratize access to assets. Well, thank you so much. If I may take just a minute of personal privilege, we've been talking about centering people. You kicked off why the importance of centering people in an economy. And in the times that we're living in right now, I kind of just want to end on a personal level and ask you what you are finding joy in these days.
Uh, I find joy in it's going to sound trite. People, honestly, the settings, they're important. They're aesthetic, the aesthetics of it. But I thrive on personal interactions. I understand that I'm a social being. I need feedback. I need warmth. I need feedback. I need conversation. That is the thing that gives me joy and keeps me going in these moments.
I couldn't agree more. Well, thank you so much, Dr. Darrick Hamilton. We really appreciate your time. Know you're busy, and we hope you can stick around as long as you can. Thank you for your time today.
Thank you. Cheers, everybody.
So, well, with that grounding, we are excited to continue our presentation today. And Blair, I will hand things off to you.
Thanks so much, Esther. And thanks so much again, Dr. Hamilton, for providing that powerful background information and just grounding us in where we are right now and why now. If folks aren't familiar with the New School, Dr. Hamilton established the Institute on Race, Power, and the Political Economy at the university. And also want to give a shout out to our close partnership with David Radcliffe there, the Director of State and Local Policy, who also worked in the treasurer's office in Connecticut when they passed their own baby bonds program. So we know why baby bonds, why now, why Colorado Fiscal Institute and Soul to Soul Sisters and this partnership is what we're going to briefly talk about before we dive into our juicy findings. So CFI envisions a Colorado where responsible, people-centered economic and fiscal policies advance equity and widespread prosperity. As a tax, budget, and economic policy organization, we know economic security is essential to people's ability to live healthy and thriving lives. And CFI has a strong track record of supporting short-term economic mobility, primarily through refundable tax credits, among many other things. And we want to invest in policies that also support economic security in the long term by dismantling structural barriers to shared wealth and power. So this is we think, a perfect fit. And knowing that structural racism is a barrier to wealth equity and that racial justice is deeply tied to economic justice, we partnered with Soul to Soul Sisters, an organization dedicated to amplifying Black liberation by championing transformative policies and initiatives that address the unique challenges faced by Black communities. So CFI and Soul to Soul Sisters have previously partnered on work connecting the dots between direct cash assistance, wealth building programs, and the health of marginalized communities, or in other words, this connection of health and wealth that I'm sure many of you may be familiar with. And we just want to stress that we would not be where we are now without the support of all of these amazing partners, including our qualified team of researchers that conducted the study. So with that, I'll hand it over to the Seed Colorado team to tell us how we make baby bonds a reality in Colorado.
Okay, you should be able to see my slides now. And I'm going to try to hide this panel as well. Okay, all right. Well, hello, good afternoon, or good morning. We're incredibly honored and excited to share new research findings on the feasibility of implementing a Colorado-specific baby bonds program. My name is Tran Doan, and I go by she, her pronouns. I'm an expert in conducting comprehensive and rigorous economic evaluations of children-focused programs and policies. I'm also a tenure-track professor, assistant professor in the Department of Health Systems Management and Policy at the Colorado School of Public Health at the University of Colorado Anschutz Medical Campus in Aurora. I'm also the principal investigator of the SEED Colorado Research Team, which stands for Systems for Equity and Economic Dignity. I'll briefly introduce our incredible research team members. We have our qualitative lead researcher, Alyssa Hernandez, who is a PhD candidate of clinical psychology at the University of Pennsylvania and a child and adolescent therapist at Nemours Children's Hospital. She'll also be leading a part of today's presentation. We also have a quantitative lead researcher, Johnny Huynh, who's a tenure track assistant professor of health policy and clinical practice at Dartmouth University. And we also have doctoral level research assistants Ainsley Buck at the University of Pennsylvania and Corey Jacinto at the University of California, Los Angeles. As Blair mentioned, we would not be able to do any of this incredible work without our powerful community partners. This work would not be possible without Colorado Fiscal Institute and Soul Sisters, and the Gary Community Ventures, Impact Charitable, as well as we also did 2 community advisory committees, and as well as other members of the Wealth Building Coalition, and of course, and most importantly, qualitative research participants. So for today's purpose, we will give you a definition up front. The definition that we're using is that baby bonds are publicly funded accounts established for eligible children at birth. Each account receives an initial government contribution that is invested until adulthood, when young adults recipients may access these funds for approved wealth building purposes, such as higher education or training, home ownership, entrepreneurship, or retirement savings. There are over a dozen policies or programs that have been implemented or proposed, and there's also a variety of different pilot demonstrations around the country, including in Colorado that launch in 2026. So this slide presents the who, what, when, why, and how of baby bonds. I won't read every single word here, just to say that the who are children born in Colorado who are eligible based on some criteria. And this criteria could either be Medicaid coverage, like in Connecticut. It could also be all children or a universal based program. I gave you the definition of baby bonds, so I won't go over in too much detail, but just wanted to highlight the focus of why a baby bonds in Colorado, which is to give children in Colorado an opportunity to build wealth and invest in their futures. Our key takeaway from our research shows that a Colorado baby bond program can increase total wealth accumulation among young people, injecting new wealth into Colorado to stimulate local economies. It can also meaningfully reduce the racial wealth gap and is considered highly feasible, broadly acceptable among 4 different types of interview participants, including caregivers, young adults, community leaders, and policy partners. And we'll go more into the how and our recommendations, but certainly just wanted to give you the upfront who, what, when, why, and for how for a specific Colorado program. We, our overall research question is implementing a public baby bond program feasible in Colorado? We wanted to give you the results right away that based off of our mixed methods economic evaluation, we found that Colorado baby bond program appears to be highly feasible across interviews with our stakeholders, with important considerations for program design implementation to straighten the political feasibility, community acceptability, fiscal sustainability, and equity implications. And we will review briefly the study purpose and our objectives, as well as our methods and findings to arrive at that key takeaway from the prior slides. So our study purpose was to conduct a comprehensive economic evaluation and policy analysis of a program for Colorado. We used a mixed methods approach, and we sought to answer and report out the total program costs, wealth accumulation over time among a birth cohort, the feasibility, acceptability, sustainability, and social economic impacts. We address four objectives, which Esther mentioned earlier, which is to one, assess the baseline wealth inequality in Colorado. The second is to identify potential sustainable revenue sources. And to evaluate the fiscal feasibility and policy impact of baby bonds layered on top of baseline wealth inequality or a do nothing strategy. And our fourth is to provide Colorado specific policy recommendations. So over the span of 10 months, we completed a mixed methods economic evaluation that included three components, which included a quantitative economic microsimulation model in order to estimate the total program costs, to project long-term impacts on the racial and geographic wealth gap, and to evaluate the changes in our results based off of alternative program designs. We used three national survey data sets, including the panel study of income dynamics, the National Center for Health Statistics natality data, as well as the American Community Survey through the census. I won't go into too much detail regarding the methods because we have a short amount of time, but I'm always happy to answer in the Q&A or provide a separate presentation on our research details. So our second approach as part of our concurrent mixed methods is we conducted qualitative community engaged and semi-structured interviews. We also applied implementation science frameworks in order to assess outcomes such as feasibility, acceptability, appropriateness, sustainability, and equity impacts of baby bonds among among families, community implementers, and policy makers. I apologize, the text has been cut off. And then we also round out these quantitative and qualitative research with a comparative policy analysis to review other baby bonds from different jurisdictions to identify promising program design features and inform a sustainable model for Colorado. So I'm so excited we're going to release the final report after the presentation, but you can find these summary key takeaways in our executive summary, which is on page 3 of the report. And we have 4 key takeaways, which are mapped against those 4 objectives that you've seen earlier, which is the first is to assess baseline wealth inequality in Colorado. And we found that without intervention, the wealth inequality will continue to grow. By age 35, white young adults will have accumulated about 3 times the wealth of Black young adults and 2 times the median wealth of Hispanic young adults. So that's under a do-nothing strategy. A potential sustainable model for Colorado incorporates a hybrid combination approach of 3 strategies, which includes combining one-time capital investment, dedicated revenue sources, as well as allowing for public-private donations to birth cohorts, as opposed to individual family accounts in order to reduce reliance on an annual appropriation process. The third takeaway addresses the impact of baby bonds. We modeled a targeted Medicaid baby bond as well as a universal program. And we also did scenario analysis looking at eligibility criteria outside of Medicaid. But we found that generally both a targeted Medicaid and universal baby bond program would substantially reduce the wealth gap, particularly the racial wealth gap. And we found that larger reductions were achieved through even broader eligibility as well as larger initial contributions from the government. A universal program could potentially inject 1.1 billion in new wealth per birth cohort by when they reach age 35, and this is new wealth on top of a do nothing strategy. So this will be in addition to if we were to do nothing. And then the fourth key takeaway is recommended key program features, including automatic enrollment, a substantial initial contribution, provision of financial education resources with an emphasis on tailored coaching, as well as consistent ongoing culturally responsive outreach to families. And then we also recommended, I apologize if text is cut off here, but we also recommended that we prioritize government-based contributions over family voluntarily contributions. So this can also be found in the executive summary on the third page, which is our policy recommendations, which is a universal program would achieve the greatest reduction in wealth gap by age 65 or approximate retirement age. In this approach, every child born in Colorado would receive public funding accounts at birth. However, it is more expensive. As you can imagine, a universal program would require total more upfront costs than a targeted program. So if we find that a universal program is cost prohibited, then a targeted program with broader eligibility also offers the strongest alternative, offering similar reductions in wealth gap by the age of 35. And we'll show you that in the results. And then by early adulthood, young adult recipients could use these baby bonds to build wealth through higher education, home purchase, small business, or retirement savings. It will be really important to clearly distinguish a baby bond from other different types of trust or investment or saving accounts, including distinguishing baby bonds from Trump accounts. And we find that it's even baby bonds alone would not completely eliminate 100% of the racial wealth gap or the geographic wealth gap. It would be even more impactful if we combine these baby bonds with other early life economic policies that addresses both the immediate, such as cash transfers, immediate needs of families, as well as the long-term wealth building needs of families. So we'll dive into our four key takeaways. And again, we're going to stay pretty high level, give you some high level results, but I'm happy to dig further into the Q&A. For our key takeaway number one, we found that under a baseline strategy or doing nothing, that the median household wealth in Colorado is about 265,600. This is all ages, not restricting to just families. In Colorado, the median household wealth is 265,600 using panel study of income dynamics data. So this is a cross-sectional data. And then that without intervention, wealth inequality will continue to grow. You've seen this before, that by age 35, white young adults would have accumulated about 3 times the median wealth of Black young adults and about 2 times the median wealth of Hispanic young adults. This is assuming if wealth building begins in the year 2026. So this would be how in their future would have accumulated this 3 times compared to 2 times the median wealth. So we know that wealth is unevenly distributed in Colorado, that not all Colorado families have the same opportunity to build wealth. Figure 1 shows that about 17% or 1 in 6 Colorado households have 0 or negative net worth. So children in these type of households that start off with 0 or negative net worth have a more difficult time in order to accumulate wealth during their own life course. Figure 2 shows that a typical white household in Colorado has about 11 times more wealth. This is in a snapshot cross-sectionally in 2023, 2024, that white households in Colorado have about 11 times more wealth than Black households and about 2 times more wealth than Hispanic households. So in our microsimulation model, we reported out the relative wealth gap ratio between white and Black and white and Hispanic across 3 different ages. We find that by age 35, which is the last age to claim funds in the Massachusetts proposal, so by age 35, white adults would have accumulated 3 times the wealth and 2 times the wealth of Black and Hispanic young adults, respectively. So you see these results are even more exaggerated for the white-Black gap by the age of retirement. So around by age 65, white adults would have accumulated about 20 times the wealth of Black adults and about 3 times the wealth of Hispanic adults. So I'll pass this presentation over to Alyssa Anendez, who was our qualitative and mixed methods lead researcher, to present on the remaining 3 out of the 4 takeaways.
Okay, great. And Tran, are you're still taking us with our slides, right?
Correct.
Okay, thank you. I got a notification to host, so just confirming. All right, well, it is wonderful to be here with you all. And as Tran said, I'm going to take us through some of our other major key takeaways. And so first, I'm going to speak towards our second takeaway here, which is focused on what a sustainable funding model can look like for Colorado baby bonds. We found that a sustainable funding model would likely require a combination of approaches, so potentially including a one-time capital investment, dedicated and long-term revenue sources, and public or private contributions at birth. So what might that look like? And we can move on over to our next slide. Based on, as Tran highlighted earlier, we were able to interview 35 folks, both involved in implementing and shaping these types of programs, and caregivers and families who would potentially benefit from baby bonds. And so based on our interviews, we heard three main approaches to creating a more stable financing model. First is, as I mentioned earlier, that one-time capital funding. So an upfront investment, such as a capitalized trust fund, could provide a foundation for the program and allow investment returns to help support baby bonds over time, rather than relying entirely on annual appropriations. Second was that dedicated long-term revenue sources. Participants discussed possibilities such as dedicated tax revenues or other ongoing sources of funding. One important Colorado-specific consideration is TABOR, or the Taxpayers' Bill of Rights, which means that a new dedicated tax would require voter approval. And Tran, can you share our quotes from our interviewees? Thank you. Believe there's two that you can share. One implementer, speaking about their respective state programs, stated, our program, where they are respectively, proposes to take a portion of what we would otherwise remit to the state and use it for baby bonds every year. So it's actually financed through unclaimed property remittances versus taxpayer dollars. And a third potential mechanism is that public and or private contributions, individual, philanthropic, or other private contributions could supplement public funding either as an ongoing basis or for a particular birth cohort. One important equity consideration that comes up here, if people can make voluntary contributions directly to individual children's accounts, that could increase account balances, but it could also reproduce differences in family wealth, because some families and donors, as you might anticipate, would be better positioned to contribute than others. One way to reduce that risk that we heard from our implementers would be to direct voluntary contributions toward an entire birth cohort rather than individual child accounts. All right, moving on. Funding is only part of the question, correct? Participants also talked about how to build and sustain a political support, right? Political feasibility for baby bonds. A consistent message was the baby bond should not be framed as only an anti-poverty program. Participants saw them as an investment in Colorado's broader economic future, including a stronger workforce, stronger local economies, increased tax revenues, and retaining young people in the state. And then sharing our quotes, as one implementer put it, baby bonds could be a way to retain youth in the state and is an economic development tool. Participants therefore recommended emphasizing shared economic opportunity as well for families, right, and financial security and broader community prosperity. Messages that might resonate a bit better across a broader political spectrum. Families and communities want the opportunity to thrive, as Dr. Darrick Hamilton alluded to, right? But that can be difficult when families are focused on just getting through the day. As one caregiver shared, we live day to day, saving is very difficult. So there's an important balance here that I want to highlight, which is baby bonds are this long-term investment, but they also need to be communicated in a way that recognizes the financial realities of families that families are facing today. Okay, that brings us to our next slide and our final point on this end. How do we make the case for a long-term investment when families and policymakers are both pressed to address these immediate needs? Participants repeatedly emphasize that baby bonds should be considered alongside issues that families are facing right now, including housing stability, food insecurity, and financial insecurity broadly. One implementer captured this tension well, quote, people are trying to be, and by people, politicians and other government officials, are trying to be responsive to voters of today and not voters of tomorrow. So participants suggested that building support will require more than just describing the policy. It will require compelling data, trusted messengers, personal stories, and real grassroots engagement. And importantly, participants saw several ways to frame baby bonds. They can be viewed as mentioned a little bit earlier, but also can be viewed as upstream investments, right? That may reduce the future downstream public costs, for example, costs associated with supporting folks who are unhoused, Medicaid, TANF, incarceration, and other public systems. So ultimately, the message here is that we heard that making baby bonds sustainable isn't just about finding the revenue sources and funding the program. It's also about building a durable case for why this is an investment in Colorado's families, the community more broadly, and long-term economic prosperity. Okay, heading towards our next key takeaway. Broader eligibility and larger initial contributions could generate greater reductions in wealth inequality. In our models, both the targeted and universal baby bonds could substantially reduce health inequality in Colorado, with universal programs, as you might anticipate, producing greater wealth building effects. A universal program could generate approximately $1.1 billion in new wealth per birth cohort by age 35, compared with lower but still substantial effects under a targeted approach. All right, so we're going to move towards a figure, and what you'll see here is how baby bonds could affect racial wealth gaps by age 35. You'll see first that baseline model and the scenario that Dr. Trandon spoke to, in which white young adults would have about 3 times the wealth as Black young adults and twice the wealth of Hispanic young adults, whereas both the targeted, so that blue figures in the middle, and the universal programs in that lighter orange, we see a decline in both those respective wealth gaps. Okay, so, and then I'm going to highlight a bit further on. So this table shows a bit of that trade-off between those two different potential targeted and or universal programs. The targeted program would serve about 22,000 babies annually compared to the 63,000 babies served annually under a universal program, resulting in roughly $70 million versus $201 million in annual costs. Over 5 years, that's about $352 million costs versus $1 billion in state investment, at least as modeled right now. At the same time, the model projects total wealth accumulation by age 35 of $4.5 billion under the baseline, 4.7 under the targeted strategy, and then 5.6 billion under the universal strategy. So the universal approach requires about 3 times the state investment, but also produces the largest increase in total wealth accumulation. With either a targeted or universal baby bond program, those gaps narrow substantially. The white-Black wealth ratio would decrease from 3 to 2.3, while the white-Hispanic ratio would decrease from 2 to 1.7. So while baby bonds would not eliminate racial wealth gaps, it would meaningfully reduce them. Moving on to our support from our families and beneficiaries. Overall, we find that there is broad support and strong perceived feasibility among families, young adults, caregivers, community-based organizers, and policymakers. Participants emphasize that the program should be easy to access, protect families from unintended harm, and include financial education and coaching. Colorado is already testing this concept through an ongoing baby bonds pilot. So what's really exciting is, together with what we're showing you all here today, as well as what we learned from the pilot, will help inform the design and implementation of a future statewide program. So we do it right. Okay, overall, now I'm going to speak a bit to acceptability, or what we think of as, do our beneficiaries, caregivers, families like this sort of program? And then appropriateness, do they think it's a good fit for the mission that we have in mind? Overall, beneficiaries express strong acceptability of baby bonds, describing them as a meaningful source of financial security, opportunity, and as a means of reducing a heavy burden of stress. As one caregiver explained, quote, "Not everybody is born into wealth. To give a child an experience where they don't have to worry about money is such an amazing opportunity." Participants also view baby bonds as highly appropriate or really great fit for addressing intergenerational wealth inequities and expanding opportunities, particularly for low wealth and first generation families. One young adult reflected, "I didn't have the opportunity to save about I didn't have the opportunity to learn about savings. I wish I would have. At the same time, participants raised practical questions about funding, and we should note these practical questions about funding, credibility, and long-term implementation. And by credibility of the government with the community, right? And emphasize that program success would depend on flexible design, credible safeguards, and access to that financial targeted coaching. Okay. So last takeaway is related to our where our evidence pointed to in terms of several important program design features for baby bonds. These include things, as Tran highlighted a bit earlier, like automatic enrollment and substantial initial contribution, financial education with a focus on that coaching, and culturally responsive family outreach, engagement, and prioritizing government contributions over family-funded contributions. In terms of program reach, a universal program would produce the greatest reductions in wealth inequality by retirement age. If universal coverage is not financially feasible, our modeling suggests that a targeted program with broader eligibility is the strongest alternative, achieving similar reductions in wealth inequality by age 35 in Colorado. So this table provides a more detailed look at the recommended design features, a more exhaustive look at our design features. These recommendations draw from really the entirety of our study, so both the economic evaluation and our comparative policy analysis, and alongside established principles for early life wealth building and considerations from the Institute on Race, Power, and Political Economy. I won't walk through these features here, but these are the key design considerations that emerge from across our studies, across our findings. And I encourage you to explore all the materials that we have put together, which include the final report as well as some one-pagers with more detail. Okay. So beyond the core design features, there are also several key implementation decisions that would need to be worked through. These fall broadly into two areas: the administrative and policy infrastructure, including things like eligibility, verification, data sharing, which is going to be critical, working across different state, federal, and within the state systems. And there's also the beneficiary experience, including family engagement, financial coaching, and ongoing evaluation and community input. Across these decisions, the goal is to balance equity, sustainability, administrative feasibility, and program costs. There are also some more specific policy questions to resolve. Just as an example, accommodations for young adults who may be unable to access their funds because of disability, incarceration, or military service. So other important considerations, just given the political climate right now, that we want to make clear, and that really came up from our beneficiaries and our implementers, was distinguishing from TRUP accounts, right? So moving on to our next slide here. One important, it's really important, right, that we make those distinguishments clear. While both involve investment accounts for children, they are fundamentally different approaches. The federal accounts provide a one-time $1,000 contribution, but their longer-term benefits really depend substantially on voluntary contributions from families and employers. Which can create very different benefits across households. Baby bonds, by contrast, are publicly funded and designed specifically to build wealth and reduce wealth inequality. So as these policies coexist, clear communication will be important to prevent confusion and ensure families understand baby bonds are what they're designed to accomplish. And we have to do a really well-intentioned and effective job in developing outreach material in partnership with young adults, families, and community-based organizations. Finally, moving to our last slide here, baby bonds should be considered as one part of a broader early life economic strategy. They are designed for long-term wealth building, but may be most effective when paired with short-term supports, such as cash transfers and other income supports as well. We see opportunities to integrate or bundle complementary strategies to improve acceptability, effectiveness, and equity in addressing the economic drivers of health. As an example, Vermont's Super Bundle brings together supports for maternal well-being, immediate income needs, and longer-term wealth building. So the broader takeaway is that baby bonds do not have to stand alone. They can be one component of a coordinated approach to supporting families and building economic security across a lifetime. And with all of that, I'm going to turn back to Dr. Trandone for our conclusions. Thank you.
Thank you, Alyssa, for that amazing presentation. And we'll wrap up with some conclusions is that we found that our baby bonds program in Colorado is highly feasible and we substantially reduce the wealth gap based off of our mixed method study, that without intervention, the racial and geographic wealth gap will continue to grow, and that baby bonds are an investment in both young people as well as the local economies in the state of Colorado. Based off our microsimulation modeling, we found that both a universal and a targeted baby bond program would reduce the wealth gap with broader eligibility and larger initial contributions, producing greater reductions, and that Trump accounts alone would have the smallest reduction in the wealth gap. And then based off of our qualitative interviews, we found broad support for baby bonds among parents, young adults, community-based organizers, as well as policymakers. And that, of course, as any study, we have limitations, particularly around the lack of clinical efficacy evidence on long-term effects of baby bonds, that national definitions, because we use national surveys, may not accurately map on to represent rural communities in Colorado. And we did have some small sample sizes for certain demographic groups. And then we also have underrepresentation of rural communities and families that speak languages outside of English and Spanish in our qualitative interviews. To round us out, we believe that every child deserves the opportunity to build a secure financial future, that baby bonds are designed to invest in children at birth and then support long-term wealth building in early adulthood, that we found off our mixed method study that a baby bond program can increase total wealth accumulation among young people. It can meaningfully reduce the racial wealth gap and more modestly the geographic wealth gap. And among our interview participants, baby bonds have been considered highly feasible and broadly acceptable. Well, thank you so much, and we're happy to answer any questions. I think we put 5 minutes on the calendar, or the schedule, but also happy to do it towards the end.
Yeah, we have a few minutes. I know that was really rich information, valuable information. I wanted to just give folks a moment to digest and see if anyone had any questions.
Yeah, this is Uriah King. Can you hear me?
Yes.
Yeah, so my name is Uriah King. I'm at For the Long Term, which is a national network of state and local treasurers. So I work with a lot of folks, including Treasurer Russell in Connecticut and Treasurer Montoya in New Mexico and others. This is great research. I think this is going to be useful not just in Colorado, but nationally as well. I do have two questions, and maybe I don't want to take up other folks' time, particularly here in Colorado, but I did have two questions. One is, at least when I've been part of debates in Washington, directly and indirectly in 4 or 5 states now on baby bonds. And one of the things that really caught my ear was this tension, the political tension between universality and targeted. And one of your findings is a bit counterintuitive to a lot of policymakers, is that universality leads to a greater reduction in the wealth gap than, say, something targeted. So I would like to maybe unpack that a little bit more if I understand, and maybe I just didn't understand it correctly. And I can stop there, but I'm going to ask a second question, and then feel free to, particularly if other folks in Colorado jump in. But and I want to be careful here the way I phrase this, because again, I'm just absorbing all this on the fly. The wealth gap was relatively narrow in your model in the around 35, relatively modest, and it increases dramatically between 35 and 65. And I'm curious to know what it was about your model that made that jump happen. I'm very curious to know what changed in those circumstances to make that so different.
Yeah, these are really excellent questions, and I am so honored that you are joining us for today's conversation. As far as the universal versus target, it is perhaps related to the limitation of our data, in which we use nationally survey data, the panel study of income dynamics, and then limited interpretations for Colorado. We did calibrate it to American Community Survey as well. We did try to do a universal smaller deposit with progressive, a tiered structure. Based off of our data, that did not have the best outcomes regarding reduction in wealth inequalities. I'm not necessarily sure why there. Um, Perhaps it has to do with a small sample size of the rural communities. We also have some rural communities in Colorado that is on the wealthier side. Maybe Vail, Aspen. Not exactly sure the exact definitions of rural because there are different criteria in Colorado. Uh, we found that by age 35 that there were similar wealth reductions under a targeted program versus a universal program, but as you saw, that we saw even more increase in the differences in the wealth gap by the age of 65. It is possible. We did generalize linear models with a couple of covariates. It has perhaps the covariates that we included: race, ethnicity, geographic, Medicaid coverage, other type of households indicators. It's possible that accounting for household wealth for an intergenerational accumulation over time that could lead to the drastic change between white and Black young adults. But yeah, we did not do a deeper dive into the temporal changes of wealth outcomes. But yeah, inheritance. Thank
Yeah,
you
I
so
think
much.
that's what you said in plain English. Sorry, and I apologize. I didn't mean to by
Plain
that.
English.
But I think you meant inheritance when you said that. That caught my ear because I think you're right. I think that's probably right as soon as you said that. That makes more sense to me now. And that's why we're here.
Exactly. And we definitely had a long extended debate and considerations and looking at the literature around our recommendation of universal versus targeted. It is also under this political climate that we made that recommendation, recognizing that there are some families that don't want to have the stigma associated with be given a handout, for
Right.
example,
Yeah.
that universal eligibility could potentially reduce administrative costs as far as automatic enrollment. But yeah, certainly happy to hear your thoughts around this as well.
Yeah, I mean, real quickly, and again, because we found that with community college, I helped develop a design a community college program in Pennsylvania. And the Tennessee model on paper is universal and somewhat regressive, and the outcomes are the most progressive free community college program in the country. And our qualitative work says that is, you nailed it. It's the stigma attached to it being a handout. It is counterintuitive, but sometimes you just got to go with the outcomes where people head. So anyway, thank you.
Great question, and thank you for your engagement.
I think we might jump back into the presentation, and we will have about 15 more minutes afterwards once we just wrap up for more questions. Awesome. Well, with all this information that folks are getting, we are sure that you are wondering what we are going to do with all of this rich data. But we have always envisioned at the Colorado Fiscal Institute, when we were working with Soul Sisters, that we would use this study as one tool to help us in this movement towards building a Colorado lifelong wealth system. And we hope to take what's in this study to help inform future policy designs and policy frameworks for early wealth building, a slew of early wealth building policies. And in order to really build this system, we're working closely at the moment with some of our coalition partners, Gary Community Ventures and Impact Charitable, to carry out this vision that we have of making the Colorado Treasurer's Office a one-stop shop, if you will, of a coordinated, centralized wealth building programs that really position all Colorado families for long-term financial stability. And we are also spending time this summer and fall connecting with and growing our wealth building coalition to ensure that we have a diverse set of partners who are joining us in this fight. We were really continue to be encouraged by the number of people from different fields who are want to engage in this work in Colorado and broadly. So those are some of the ways that we are hoping to move into this next phase of work, taking research into coalition work and policy building and continued education. Based on some of the questions we've already gotten, there's so much work to continue to do, so much education so that people understand baby bonds. So they still are, somewhat of they're a novel idea and still new. So there's a lot to be learned. There's a lot that we want to expand on our study so that we can dig more into the details of what that means. And what we've learned from partners and policymakers as well is that there's just a lot of education we need to do um, for people to broadly understand what are the differences between baby bonds versus 529 accounts and now the 530A accounts, which have come into the picture as well. And so part of this launch also includes being able to provide more education around baby bonds. So with that, I will hand it over to Blair to share a little bit more about how you all can join that fight.
Great. Thanks, Esther. So there's an incredible diversity of backgrounds on this call, and this is a growing movement, and we need everyone in Colorado to be a part of it. And there are many ways to plug into this work, depending on interest, capacity, expertise. So one way is to join us in the Wealth Building Coalition. We're sharing a link in the chat to a brief survey where folks can let us know about their interest and capacity, and we'll follow up with more information. We would love to have you. As Esther mentioned, we really need everyone in this fight. Another thing that folks can do you know others who would love this work, who need to hear about it? Request a presentation for your group. We're happy to bring it to them and want to spread the word. This is not a secret we're trying to keep. And we now have the research and the evidence to show the feasibility of baby bonds in Colorado. The next step is turning that knowledge into policy and action, and that will require sustained investment. So philanthropy has a critical opportunity to help make that possible by supporting the organizations leading this work and investing in the coalition needed to build momentum for lasting wealth building solutions. My colleague Maggie is on this call if any funders or individuals would like to discuss what an investment in this work could look like. She would love to chat with you and put her contact information in the chat just now. Finally, as Esther said, stay informed about other exciting parallel efforts happening in the space, like Gary Community Ventures and Impact Charitable's Ignite Futures Fund. We'll share the link to that as well. This is a wealth building pilot program underway in Colorado that you definitely need to know about if you don't already. And now we know we have a pathway to make baby bonds a reality in Colorado. Please join us in this work. And with that, we'll open it back up to some Q&A.
Esther, what was the account that you just mentioned? The third one? You said baby bonds, 529s, and what was the third one?
530A as in ABC. Those are the ones that are commonly known as the Trump accounts, which were created last year.
Okay.
So, yeah.
Cool. Thank you. I hadn't heard that denomination, so I was trying to find it. Thank you.
Yeah, we're trying to delineate them as much from, the Trump account name, but and trying to talk about them as their IRS code 530A, but they're the Trump accounts. Well, again, thank you all. We have some time reserved for questions. And I know Blair shared a few things in the chat. So we have a survey that we hope that you all take a moment to fill out and let us know in what ways you would want to get engaged in this work. We welcome all of our friends to join us for this. And we also shared a link to the Ignite Futures Fund, which we're really excited about. That is the pilot program, the early wealth building pilot program demonstration that Gary Community Ventures and Impact Charitable are leading. So there's a lot of rich information that we know will come from that pilot that we hope also informs this effort. Thank you all so much for joining. Please feel free to reach out to us Blair and I can add our emails in the chat as questions come up. We are excited to fully release the report after the presentation today. We will follow up with the recording. And thank you all. We hope to see you soon.